Don't even need a microphone. He said it's going to be Zoom.
So yeah, they'll have you speak into the microphone just so that it gets relayed, to the Zoom.
Oh,
Yeah.
so I have to use a microphone.
I mean, this one's wireless, so if you want to stand up, you can grab that one. Yeah. Do you feel comfortable grabbing that microphone on the
Oh,
end?
this one's good.
Because that one's wireless as well for here. Can you come over here?
Oh, I see what you mean.
Yeah. I see how this is gonna go. I see how this is gonna So I'll introduce you and everything first, and I'll go here and let you know. I think that's yours. Well then. Hello, I'd like to welcome you guys all to the space. Thank you guys so much for being here today and supporting us, the Native American Center, and all of our collaborators and participants for addressing these really important issues. So thank you so much. I'm just going to start with doing some introductions, and I would just like to introduce myself first. So I'm Rachel Davis. I'm the Native American Center Coordinator here at UWSP. I was actually a student here. I graduated in 2010, so I'm an alumni. It's so good to be back. I'm an enrolled member of the Sac and Fox Nation. I feel very honored and grateful to have the opportunity to give the students the same opportunities that I had when I was a student here. And part of that is creating spaces for us to come together and be a community. And that's what we intend with these types of series of talks that we hope to have more in the future with a lot of the issues that are facing Indigenous people. So first I would like to introduce Dennis Connote, Menominee Elder, Language of Culture and Commission, Menominee Language and Commission supporter of missing and murdered Indigenous women, and member of the Menominee Indian District School Board, K through 12. He'll be leading us in our invocation today. Skye Alloway, who is a language and cultural manager of the Forest County Potawatomi Museum, Cultural Center and Library, and co-chair of the Wisconsin Department of Justice for Murdered and Missing Indigenous Women Task Force. She also serves as co-chair of the Chancellor's Commission on the ancestors buried below us here at UW-Stevens Point, which is partnering with the UW-Stevens Point administration to establish a cultural resource management plan with various tribal nations in the region, and also overseeing the creation of a permanent memorial for the Indigenous ancestors buried underneath the campus here. She is also on the board of Wisconsin Conservation Voters and HIR Wellness. And so we also have some virtual participants with us today. Justine Rufus is a rural coordinator with the Wisconsin Coalition Against Sexual Assault and co-chair of the Wisconsin Department of Justice's Murdered and Missing Indigenous Women's Task Force. She previously served as Bayfield's County Outreach Program Coordinator for the Center Against Sexual and Domestic Abuse. She has been working in the human services field for more than 12 years. In that time, she has helped establish 2 nonprofit organizations, rewrite domestic violence codes for the Red Cliff tribe, as well as direct the Red Cliff Family Violence Program. We also have virtually with us Dr. Janelle Lupke, a postdoctorate nurse research associate at UW-Madison School of Nursing. She earned her PhD at the University of Wisconsin-Milwaukee and previously taught in the nursing program at Edgewood College in Madison, Wisconsin. She received her BS and MS nursing from the University of Wisconsin-Madison. She's an enrolled member of the Bad River Tribe of Ojibwe Indians. Her area of research and expertise include intimate partner violence in the lives of American Indian women, community health nursing, and utilization and application of post-colonial Indigenous feminist methodologies. She is a survivor of intimate partner violence and is passionate about sharing her knowledge on a personal experience to help support and empower other women to transition to survivorhood. We also have Kea Graviter, a member of Stockbridge Muncie. She has shared her art with us here today, and it is inspired by the missing and murdered Indigenous women. We did have invited Maya Decora, who cannot be with us here sadly, but we appreciate everyone being here today who could be. And we still would like to support her cause, Justice for Cozy, as she has led a fight to organize for justice on behalf of her young sister. So thank you guys all again for being here. I know we have a lot of nursing students, and it's so important for you guys to be a part of these conversations, as women will walk into your office one day, you know, having experienced these types of things. And I think this background knowledge will be of great benefit to you in understanding the context in which these things happen. So thank you to Rob Harper for helping to organize this and being an advocate for the Native students here. And thank you to American Indians Reaching for Opportunities student organization for helping support this event and the promotion of it. I'm just feeling a lot of gratitude, and so thank you guys. With that, I would like to have Dennis lead us in our invocation.
All right, thank you, Rachel. And we Skye wanted to pack it Maui York. And in Menominee, I said, good evening, everyone. I've been asked to do the invocation here, which is always an honor for me to be able to do this. I was giving my tobacco. We use tobacco in our prayers when we speak to the Creator. But before I do that, I just want to say a few words here. I did a little research on this missing, murdered Indigenous women, and I'm glad to see this event is happening here this evening. This is really a really nice thing for everyone to attend and be here. So I'm just, maybe you've seen this or heard of this before or actually saw it, but I'm just going to read from what I did on my research. Missing and Murdered Indigenous Women, or MMIW, is a global movement to bring awareness to the acts of genocide. Thousands of Indigenous women, girls, and Two-Spirit that are enduring. This is a historical issue rooted in racism, gender-based violence, and settler colonialism. Since first contact in the so-called Americas, settler colonials have raped, murdered, and trafficked Indigenous women and girls. This violence is still happening today due to the lack of data, jurisdiction confusion, and intentional silencing of Indigenous peoples. Indigenous grassroots advocates are working to change that narrative and are rising up to fight for the missing, murdered, and those yet to be born. Because of COVID, this issue of MMIW has been put on the back burner. And so I'm glad to see that we are finally making this aware to, the public and all the Indigenous tribes in this Great Turtle Island. we as male warriors, we are the protectors of our women. And this is the way we have, this is our feelings towards these women that are being murdered and raped. We have to step up and protect them as much as we can. So with that, as is our way, I'm going to now speak to the Creator with the opening invocation in the Menominee language. Our language is from the Algonquin dialect, and very sacred to our Indigenous tribe. So with that, please remain seated. The person who is speaking to the Creator is the one that should be standing. So I do have my, like I said, my tobacco. This is called Neknamau. That's Menominee for tobacco. You'll notice I will not be removing my cap when speaking to the Creator. That's because I am wearing an eagle feather. And that eagle feather has to remain in my possession while I am speaking to the Father of all fathers, which is the Creator. So with that, I'm now going to do my prayer to the Creator, and I'm going to ask Him to watch over in each and every one of us. I'm going to ask Him to accept my tobacco. I will pray to the four directions. I will thank Him for giving us life and strength as we go forward on our journey. And something I say in my prayers, no matter what the occasion is, I ask the Creator to teach us to be kind to one another and to pick us up when we fall. So with that now, I am going to speak to the Creator in the native language of the Menominee. Poso mauni wiak, ki tana miak and moa. Matno scoop piak, mauni wiak yosiom, mamachik tau, miyakati yosnika, nimanini tan skunianan. Dennis Kanot, Mokamani Wishwan, a page pamohna, mamachik tau ni wishwan. Nitawan o matno mane, kachki, mishik, semakanas. Nahao mamawa kohono, yogwa awigs om neknamao. Kata inasamoanan, kimasamasamanok skill kanawat tuak a konil eskutu and espamianes. Ochika sia enaka, skamokaha enaka, sawano enaka, skanik enaka, the four directions. Paso tapanao sauni no tamanok wawanans kata kea, skes pitaya omas. Nahao enepi, mamawa kohono, the mamia tatan salpach no tawea ni toko timanao. Mishik nanamia. Mawa akum wisakasim. Mawa akum kachkiwak. Mawa akum semakanesak. Mawa akum nichianak. Nahao mamawa kohono ni mamanita tan salpach no tawea ni toko chimana. Pimana. Mawa akum kiki totoak. Ayatuak. Yosnika. Wawan and Katan and Maoni Kako Nick Skase Mini Kias, I'll patch Pamatasea, Mashik Muskosuan. Kaki no Hamawea, Salmano, or Totowa Kuak, Maoni Wiak, Mashikta, or Tapano, Kipapachanatuk. Mauni wiak, Mama Kohono, Mesia, Mauni wiak Sakum Pamaska Kiwayan. Mauni wiak Wawanan Katanan, Kitana Mu in Ixkis, Patawanik. They tamoi makanak now in Itka, Wawanan.
Dennis, thank you for that indication. Leading us in our conversation is going to be Skye.
Thank you, Rachel. So actually, Justine and I will be co-presenting, and Justine's going to be sharing our slides here in a moment. I just want to say thank you to everyone for being here. I know it's rainy out, and it's really great to see everyone out here, and I especially appreciate the nursing students that came over. Rachel was mentioning that the nursing professors incentivized some of the attendance for that, and I really appreciate it because, as Rachel was saying, the nurses will be some of the first frontline supporters for a lot of these prevention techniques that we're going to be talking about, and a lot of the solutions that will really make a difference. So thank you all for being here.
Are you able to see the screen?
Yes, ma'am.
Okay. So we know that we introduced ourselves before, but Skye and I are did some small introductions, but we are a chair women for the Wisconsin's MMIW task force, and so we do a lot of work together on this issue, and so we decided today we'd like to present this information together. So I'm Justine Rufus. I am a tribal member from the Bad River Band of Lake Superior, Chippewa. I am a mother of two. I have a son and a daughter, a 20-year-old and 25-year-old. Skye, if you want to just do introduction.
Holloway. I'm a Forest County Potawatomi member. I'm also a mother and a language and culture manager for my tribe, Forest County Potawatomi. And then, as Justine said, we serve as co-chairs for the Wisconsin MMIW Task Force. So what we're here today to talk to you about is the MMIW epidemic that we're facing. And we wanted to go over a little bit about the origins of the violence because it's an issue that has gone on for hundreds of years. This isn't something that's new, that is just becoming an issue today. This is something that has roots long before any of us were here, and it's something that we wanted to highlight. So if you take a look here, pre-contact, 1492, there was an estimated 100 million Indigenous people in the continental 48, which at the time it wasn't established, it was just Turtle Island to us. And we had advanced civilization with established trade routes in North and South America. And that's important because it's a common misconception that there wasn't civilization prior to contact, when there really was. There was established routes of trade, agriculture, all of the things that a civilization needed to survive. And that brings us to the point of contact, which is where a lot of these things began. With the disease, enslavement, physical and sexual violence, all equaling trauma, loss, and grief. So these things were new to the Indigenous peoples of this land and really impacted the development of our people, starting as far back as that. We continue on with the governmental procedures and processes that were specifically created to exterminate the Indigenous peoples of this land. Things like Manifest Destiny, westward expansion with colonization and settlement, and the establishment of reservations. Some of the things moving on towards 1830, there was the Indian Removal Act, which saw our people being removed at gunpoint, babies being killed, people starved, elders, all of our forms of family and relationship and ways of life were being destroyed. And this was all systemic, it was all intentional, it was government funded and promoted. So this was a specific mission to rid these lands of our people, the Indigenous people of Turtle Island. Included in that was the land dispossession or cession, a loss of 1.25 billion acres, again in the continental 48, which was where all of our people were established with their own communities, their own languages, all of our ways of life. And this was forced removal, and again, it was established by the government intentionally. This wasn't an act, this wasn't, a common misconception is that the Indigenous peoples willingly left or moved or just migrated, but it wasn't. It was a specific goal of the United States government to remove, and it was an act of assimilation. So we move forward. One of the big things that affected our people was boarding schools, both government and religious. Over 60,000 children subjected to corporal punishment, which was used as a method to remove language, culture, identity, and to assimilate the children, our children, to become what the United States government believed was the proper way to be. And this was something that isn't too far in the history. So this is something that I get a little, I feel very strongly about, because I am a survivor, or I'm the child of a survivor of the boarding schools. The last boarding school in the United States closed in 1970. My father was born in 1940, so he spent his childhood in a boarding school. And that really affects the family moving forward. It changes the trajectory of a child, of the family, of the parent, and it does accomplish the goal of the United States government to assimilate the child, the family. And then in Canada, the last boarding school didn't close until 1996. And then another proportion of that was the child protective systems, protection used very loosely, where in South Dakota, for example, 1/3 of the children were removed and placed in non-native homes. So the Indian Child Welfare Act, that was put in place to mitigate and repair some of the losses and to try to put protection laws in place for these children, which passed in 1978. And here in Wisconsin, WICWA, Wisconsin Indian Child Welfare Act, didn't pass until 2009. So until 2009, it was legal for Indian children to be removed and placed with placed in non-native homes, and continue the assimilation process where their languages were removed, culture, families, their identity. So that was as recent as 2009. Justine, you can go to the next slide.
Yeah, so thanks for that, Skye. And I think that, we talk about that there was 100 million estimated people here prior to European contact. And I always think about the fact of the survivor rate. We ended up with a population of 250,000. We currently are only 1% of the United States population, when we Indigenous peoples, as we all know, have been here the longest and have the lowest population rate. So assimilation, termination worked. We have 1% of today's current population. So I think it's important to talk about. And I think about the resiliency of the folks that were left, the 250,000 estimated after post-contact. That's our ancestors. And so if you think about 60,000 of those children being taken off to boarding school, that's a huge population of the 250 remaining thousand Indigenous people that are here. So I just love that you brought that into the conversation, Skye, because it's important to talk about our history. I think another area that we like to talk about is what's happening today. Today, American Indians have the highest rates of rape by ethnic groups outside of our own race. 1/3 of Indigenous women will experience sexual abuse in their lifetime. In 2003, only 54 cases of sexual assault against American Indian women were prosecuted by the U.S. Attorney's Office. And in 2017, the U.S. Department of Justice declined to prosecute more than 1/3 of our cases that were referred to them in Indian country. And it was quoted that that was business as usual, according to a report by the department.
So this, to continue a little bit with what's happening today, violence in Indian country. According to a study from the National Institute of Justice, some 84% of American Indian and Alaskan Native women have experienced violence in their lifetime. And while 35% of women and 33% of men experience violence at the hand of a Native American perpetrator, a whopping 97% of women and 90% of men experience violence committed by non-Native individuals. If we look to the right, these are some of the systemic causes of violence against women and some of the ways that, some of the barriers that Indigenous women face when they reach out for help, or maybe why they don't even attempt to reach out for help. So there's environmental and economic policies, high levels of incarceration, tensions with law enforcement, jurisdiction and sovereignty issues, historical trauma, which that speaks to some of the things that I mentioned in the previous slide. All those things that were created and the harm that was caused by the United States government, of course, would cause a lack of trust in the government or the governmental agencies when reaching out for help. Distrust of healthcare and social services agencies for those same reasons, and barriers to seeking or receiving help. Again, with some of these other causes, it all ties in together to create a system that isn't conducive to protecting Indigenous people.
I think that we talk about like those jurisdictional issues and things that are barriers. And as we're doing our work, Skye, I know that we're really finding that the evidence is still current today. We lack infrastructure, we lack funding. We don't have, we still have in non-public law 280 states where the maximum sentencing for major crimes, sexual assault, murder, is 3 years if you have all the infrastructure in place for a non-Indigenous tribal member, but it's a maximum sentence of 1 year. So when we talk about that, I'm talking about major crimes committed against our women, and the maximum sentence that someone would receive for that violent crime would be 1 to 3 years. When everywhere else in the world, there's the sentencing would be much higher than that. So I think it's really important to talk about like those issues, Skye, and what we're finding in our work is those issues still exist today. So when I think about the MMIW movement and where that began, it was really with our families, you know, saying that enough was enough. They really wanted to create awareness around this. And so our work with the task force did begin in a really grassroots effort. It began with women and families in our community that were demanding justice.
So this goes into a little bit more of the history, the forms of contemporary oppression, and contemporary is used very loosely. It's kind of something that has been happening since the 1950s. The Indian Relocation Act, which was mentioned before with the removal of our Indigenous people. And then we have the Supreme Court case Oliphant versus Suquamish, 1978, where it was established that there was no criminal jurisdiction to prosecute non-natives committing crimes on trust lands. So that means that any non-Indigenous person could commit a crime legally on trust lands and not be prosecuted for it. It was in 1978. PL 280, 1953. I know Justine could talk a little more about this one.
So Public Law 280 was established, and it's only affecting certain states, but it really gives concurrent, and I want to make sure I repeat that it's not separate jurisdiction, but it gives concurrent jurisdiction to counties. So basically in public laws 280 states, our civil courts are being handled within our tribal communities, and our criminal courts are being handled within the county. And what we see as a result of that is high incarceration rates in public law 280 states, a lack of protection, a lack of prosecution, and really a struggle when it comes to protecting our the government being able to having access to protect our own people as our sovereign right is.
And I see that we're getting closer on time as well, but I encourage everyone to take a look at this list here. These are things that you can research and study on your own to learn a little more about the causes and root effects of MMIW. These are things that you can research and find more information about on the DOJ website. You can also join us for the Wisconsin DOJ quarterly task force meetings where we discuss a lot of these things and we're looking to find solutions. We're working with a large group of people towards this. We skipped one with the task force creation. So the creation of the MMIW task force was authored by Renee Grauwix and Lisa Hirsch. It was these two Indigenous women that began the policy work to demand changes from legislation to not only reduce but eliminate violence against Indigenous women. They sought counsel in developing this bill, such as Pam Johnson from AIAA, American Indians Against Abuse, who was key in providing edits and revisions to the draft. Renee also partnered with WCASA, which is who Justine works with currently, lawyer Ian Henderson, who helped provide consultation, lobbying work, and how to best gain attention for this important bill. They reached out to Representative Amanda Stuck, who soon then sponsored AB 548.
Just so you know that this bill didn't pass legislation, the task force was ultimately taken on with the Department of Justice, and so we had to find a different route because it did not pass through legislation in the way that it was presented.
Yeah, and that's something that's so important too, because it was something that there was a moment in time where it could be supported by legislation and it was not. So that was a very critical moment for us, and it was critical that the Wisconsin Department of Justice picked up the task force duty and brought it forward and created this task force independently. So why does it matter? As a task force, we're seeking to offer closure to families of those who have gone missing and are murdered. We're working to minimize and eliminate barriers to care for victims, survivors, and families. To understand these barriers, we must understand the systemic oppression. Some of the things that we've been talking about a little bit today. Indigenous people experiencing violence are experts in what they need in terms of interventions. In close partnership with the DOJ, we have developed subcommittees comprised of Indigenous subject matter experts and allies. Now, to speak to this a little bit, our families and our survivors lead everything that we do. We reach out to them and we seek and utilize their guidance because they're the ones who know what will help the most. They're the ones who know what will be most effective impacts, and they know where the gaps are. So all of the things that we do here on the task force are family-led, survivor-led, and solution-based. We also advocate for prevention and survivor-led interventions that will improve effectiveness in serving victims, survivors, and families.
So I know that Skye was able to talk about what has happened in the past in the historical context, which I think really leads into what's happening today. So today, there are the remains of more than 1,000 Indigenous children found at a former residential school in Canada. And that was published as of July 13th. In New Mexico, nobody saw me. Why are so many Native American women and girls trafficked? Nearly a quarter of New Mexico's trafficking victims are Native Americans. 20% of the trafficking victims, through the report of the Minnesota produced MMIW report, 20% of their sex trafficking victims in Minnesota were Native Americans, but only 1% of the population. Nationwide, it's estimated that 40% of sex trafficking victims are Indigenous peoples, and we're only 1% of the population. So the MMIW task force was established because, number one, this is really happening. It's happening here in Wisconsin. And as we were doing our work as a task force, there were families that had missing relatives that a number of them have reached out to task force members just looking for help because they weren't seeking or finding help other places. We did have families that were murdered here in Wisconsin. And so MMIW is a real issue, and the families are demanding that it can no longer be ignored. The task force objective, the missing emerges, our task force is charged with helping to fight the abduction, homicide, violence, and trafficking of Indigenous women. The task force plans to focus on examining the factors that contribute to MMIW, and we're going to be providing a report of the status of MMIW in the state of Wisconsin, along with an implementation plan that will be reported out and estimated in December of 2022. I think that it's always important to remember that this is truly happening. And Caitlin Kelly, while we were doing our work as a task force, did go missing, and her remains were found in the Menominee Reservation. We were going to have another family member here today to talk about it, but Posey Decora also was murdered in another state as we were doing our task force work. So I'll stop share there because I know we're going to talk a little bit about that later.
Thank you, Skye and Justine, for all of your work on the task force, for presenting here today, just kind of giving some historical background and understanding. I find it even interesting myself, you know, that we don't know these things, that they're not taught to us in public K through 12 education. You know, it wasn't even until I became a student here at the university that I learned of the history of boarding schools and things like that. And I just encourage people to not feel dissuaded, you know, that, you know, you don't know what you don't know, but now that you know that there are things that you can learn more about, I encourage you to continue to research the truth behind where we are today. So thank you so much. And that will bring us to Janelle Lupke, our next speaker. So thank you.
Thank you. I'll go ahead and share my screen. Are you able to see the slides?
Yes.
Okay, and you can hear me? Great. All right. So I'm really glad that there's a lot of nursing students here this evening. As a nurse, I always get excited when I know that there'll be students attending sessions like this, because it really is so critical to our practice. And similarly, when I was a nursing student, I do not recall learning very much about you know, even in intimate partner violence or domestic violence, or, you know, really how to care for survivors. So I always look forward to opportunities to sharing my experience and expertise with students. So so good evening, and as mentioned before, my name is Janelle, and my spirit name is Ogamakwe, which means woman leader, and I'm an enrolled member of Bad River Band. I'm a postdoc nurse research fellow at UW-Madison and an incoming assistant professor this fall. I'm also a task force member, and I co-chair the data subcommittee with Rachel Fernandez, who's also a Menominee tribal member. So looks like I gotta use. Okay, so I'm here tonight to share my experience and knowledge about the topic of gender-based violence as a nurse researcher. As mentioned previously, I've been a nurse for, this will give my age away, almost 22 years. A lot of that time I've been in the community setting as a community health nurse before I went into research. And I've worked for tribes, and some of the work I did was with the maternal child health population. So I did lots of home visits to moms and babies. And I really, through my years of being in the community, I saw firsthand the impacts of gender-based violence, including, intimate partner violence, sexual assault, and even trafficking. So as a nurse, obviously the way that violence impacts health is what's really important, and in knowing how much violence can impact health and health outcomes and really contribute to those health disparities. And, aside from obvious physical injuries, and in injuries that may not be so obvious, when we may come into contact with relatives or survivors of violence, especially those of us who work in the community setting or in acute care settings and emergency rooms, we do see things like strangulation and then head injuries, which may not always be so obvious. The worst outcome obviously being, homicide, but we also sometimes see suicides due to ongoing violence that really is a manifestation of mental health issues that can come about as a result of violence. And then we see maternal child health outcomes also that may manifest as some of those health disparities. We do sometimes see mortality related to pregnancies where there was violence going on during the pregnancy, and I'll talk a little bit about that when I talk about my research. We also know that there's a higher risk of sexually transmitted infections, including HIV, among those who have been sexually assaulted or in violent partnerships. We see more chronic pain, more frequent illness, and then really an array of mental health issues, including depression, post-traumatic stress disorder, complex PTSD. We also see drug and alcohol misuse, eating disorders, and sleep disturbances due to violence and especially violence that's ongoing. There's also things like decreased productivity, missing work and school, because when we're experiencing trauma, we're not the best versions of ourselves, and it really does impact our health and well-being. So as a nurse and a nurse researcher, thinking about all of those, the ways that violence can impact our health and our health outcomes, and wanting to decrease or prevent violence, so we can decrease those health outcomes, because violence really is a preventable public health crisis. So the research that I've done as a nurse researcher, as a PhD student, in the spring of 2020 is when I carried out my dissertation study. And I really wanted to better understand how intimate partner violence manifests in the lives of Indigenous women living in urban areas by centering their voices and doing this through storytelling of their individual lived experiences in that local context. And the impetus of that research was my own personal history as a survivor but also knowing what was going on in our communities. And this is reservation-based areas and urban areas, knowing that Indigenous peoples are disproportionately impacted by gender-based violence. And by gender-based violence, I mean all types of violence, physical, emotional, verbal, stalking, cyber stalking, trafficking, being put in being exploited sexually. So the stats, we have lots of stats that we know that this is highly prevalent in all areas, again, really in any Indigenous population globally, our First Nation relatives, Australia, New Zealand, Central and South America. So it's not just something that's happening in the United States. And as Skye mentioned previously, although we have lots of current colonial statistics, we know that this is something that's been happening since the very first contact that we've had. And this is something that our Indigenous relatives have been voicing and trying to bring to light for decades and decades. It seems like now we're finally listening and taking that seriously. So when I talk about this topic, I always like to highlight that we do have lots of current statistics, but this is not a new phenomenon. I also really wanted to address a gap in the literature. Prior to my study, there were no published studies about intimate partner violence among Indigenous women, specifically in Wisconsin. So this is an exemplar of Indigenous feminist activism through a study that's led by an Indigenous nurse researcher and survivor of intimate partner violence. So highlighting the findings of this study and some of the significance and lessons learned from it is similarly to what it was in the literature and other areas. There were many barriers that existed, that do exist, that prevent people from getting the help that they need and deserve after experiences of violence. And I interviewed 34 cisgender women that were residing in the Milwaukee and Green Bay areas, and 70% of those participants had reported that they did not seek help after experiences of violence, even though they had experienced physical harm. Some of the things that were most alarming to me was, aside from those who didn't seek help, the number of people who experienced violence during the pregnancy period and those who experienced harm during more than one pregnancy, I found to be very alarming. Survivors really spoke of those linkages that I mentioned earlier between their experiences with violence and adverse health, and also pregnancy-related outcomes. The COVID-19 pandemic really served to exacerbate those barriers, especially when the pandemic was first starting to hit and we were seeing the safer at home orders. I unfortunately actually had to exclude a few participants from my study out of fear for their safety because of the safer at home orders. So it was a little traumatizing for me as a nurse researcher to know that there was so much need in the community. And although I was very diligent about connecting people to resources, just knowing that people were stuck at home with someone who was harming them really weighed heavy on my heart. And it's something that I still think about a lot today. I learned that violence is very intersectional. There were many relatives who experienced different types of harm within an intimate partnership, such as intimate partner violence. They were also experiencing sexual assault or trafficking within the same intimate partnership. So oftentimes when we talk about domestic violence versus sexual assault or trafficking, it's often assumed that those things never happen at the same time, and that really is just not the case. Just to expand a little bit about those barriers to help seeking, what aligned with other literature that's out there is that Indigenous women and Indigenous peoples really often are reluctant to seek help after experiences of violence. And sometimes we know that silence in and of itself is a trauma response, and voices have been silenced for centuries and they're still being silenced. And there are many, many reasons for barriers to help seeking that could be, a 2-hour lecture in and of itself. But some of the things that I found in my study were lack of resources, lack of community-based or sexual assault advocacy, geographic barriers, transportation, a lot of personal barriers such as fear of retaliation, fear of privacy, exposure, and also a lack of culturally specific resources. As mentioned previously, COVID-19 really served to exacerbate violence and create more barriers to help seeking. We know through community partner agencies, they had reported higher numbers of crisis calls or increases in needs in the community related to partner violence and sexual assaults. And this data is, I did not update this, unfortunately, but the last data that I had added to this was towards the end of 2020. We had already lost 70 lives, and I know it's more than that, related to domestic related homicide. And unfortunately, a lot of those victims, or a chunk of those victims, were under the age of 18. So we did see increases in violence during the COVID pandemic, and we're still really kind of sifting through that data and getting a better understanding and unpacking all of the ways that COVID have exacerbated violence. An exemplar of some institutional or structural barriers that I noticed in my research was that people, survivors really felt like their voices weren't being heard. And survivors are down at the bottom when really this should be flipped upright, where survivors' voices are at the top, and that their voices and choices are being honored. So just to give you kind of a picture of the hierarchy of some of the decision making that can happen when there is a report of a sexual assault. In my study, I also collected, when I asked about experiences with healthcare providers, this wasn't necessarily just nurses. This could be doctors, law enforcement, social workers. But some of the biggest ways that we have unknowingly caused harm as healers and providers was really, it boiled down to not listening and survivors feeling like they weren't being heard or they weren't being taken seriously. There were a lot of missed opportunities for screening, ignoring needs for safety. There was even victim shaming and blaming, sadly. And that paternalistic attitude, like the picture I showed in the slide before this, of providers thinking that they know best for survivors, when really survivors are the ones that know what's best for them. Oops. Lost my little cursor. Okay. All of the things that I had just mentioned on the previous slide are more, 99% of the time are done unknowingly through, implicit bias. And a lot of it is just the way that our worldview has been shaped. Things like dominant social norms, justification of racism and sexism, again, learned through those social practices, the way we were raised, the things that we witnessed, learned from our friends, our teachers, even college professors, and within the community. They become assumed as truth, and eventually they become embedded into our policies, our clinical practice guidelines, within interventions, academic curriculums, and most of the time all done without those that are intended to be served. So, this is something that is highly problematic, that needs to be addressed. And ultimately, what happens is it impacts access to help after experiences of violence. And why that's important, why am I, talking about this as a nurse, and, why I talk about it with my students and those who are learning to become healers, is because we have to always be cognizant of that and actively resist re-traumatization and perpetuation of oppressive practices. And we are always seeking to minimize and eliminate barriers to care for survivors. And we do this through understanding and ongoing self-reflection, and always remembering that survivors and the community are the experts in what they need in terms of interventions. And we can do this through the creation of survivor-led and community-led interventions. This is just a slide to really kind of pull together a theoretical framework of my research practice. Really, it's decolonization of research practices, which really is praxis, which is putting theory to practice. It's embedding social justice within our research program and in everything we do, and always actively resisting, further problematizing. We do this through connection, relation, and belonging, and using methodologies that are analogous to decolonization. And I specifically do this through community engaged research, narrative research, such as storytelling, and photo voice, which is visual storytelling. I also just wanted to briefly touch on an exemplar of putting theory to practice. Aside from the academic research that I do, I'm also involved in a service grant called Tracking Our Truth. And this is really an example of putting that theory to practice of decolonization. This is an academic community partnership. It was a grant that I helped write while I was still a student at UW-Milwaukee. And It involves partnerships of community-based organizations, really with the overarching goals of trying to expand options and choices for Indigenous women after experiences of sexual assault. So it was a $2 million grant. And with that grant, we have and still are hiring sexual assault nurse examiners and community-based sexual assault advocates to be based in the community in the Milwaukee area and also in the northern part of the state. We're offering trainings from the International Association of Forensic Nurses. We have a 40-hour clinical skills lab in Milwaukee and the northern part of the state, so we can train more RNs to be certified as sexual assault nurse examiners. We're also offering community partners to attend the Red Wind culturally specific 40-hour sexual assault advocacy training program. And we're also working on developing a tribal sexual assault response team in the northern part of the state and in Milwaukee. Specifically, we partner with Gerald L. Ignace Indian Healthcare Clinic and her Wellness Institute in Milwaukee. And at Gerald Ignace, we have employed a sexual assault nurse examiner who also serves as a coordinator, who'll be responsible for helping to hire an additional SANE nurse and training, doing more outreach, and working alongside 2 community-based advocates. We also fund a full-time 24/7 sexual community-based sexual assault advocate at her Wellness. And then in the northern part of the state, we have the same partnership with a few of our community partners up north, developing a sexual assault nurse examiner program in Rice Lake, and then employing community-based advocates as well. Again, doing all of that, again, to expand those choices and options for our Indigenous relatives after experiences of sexual assault. And things that I've learned, and our partners and our academic team through that grant is really thinking about ways that we can best support survivors. And these are the things that I think have really been the biggest lessons. Some of these come from the voices of survivors, things that they, when I interviewed them, I asked, if they didn't have a good experience, what would they, would they feel that it would have gone better, or how could they have had a better experience, or how would they like to be treated going forward? And these were the biggest things. Just having that humanistic care, that each person is an individual with a story that we must listen to attentively, respect confidentiality, not jumping the gun or reporting things, promoting access to services, validating and believing experiences, and really respecting autonomy, health and safety planning however we can, acknowledging the injustice, and really being aware of the resources that are available so that we can make sure that people are aware of the choices and options that they have. So if and when they do choose to either report or get help, that they have it there when they need it. Also, really practicing, nursing with that culturally safe lens. And really all that means is that we're creating an environment that's spiritually, emotionally, and socially safe. So there's no assault, challenge, or denial of their identity and needs. Again, it's that active resistance to not re-traumatize or perpetuate oppression, knowing about culturally specific resources available in the community and being able to refer people to services, and really not being afraid to just ask, how can I best support you? Is there anything I need to know about your cultural preferences? Asking about preferred pronouns, what they preferred to be called, especially those who might be trans or non-binary. People may not go by their birth name, they may have a different name, and making sure that we're addressing people how they want to be addressed so that they feel safe. And this is just a quote by Peggy Chin about nurses as allies and activists. The fact that has been that nurses, dating from the earliest days of the profession, have engaged in social and political activism, but have remained reticent to fully embrace social activism as a core nursing concern. Every time a nurse acts to bring nursing values into action, bends over backwards, jumps through hoops, and does cartwheels to obtain what individuals and families and communities need to be healthy, we are acting politically. We are activists. And then I just wanted to end with a quote from a participant, and this is a pseudonym, that there, although I interviewed many people who were still experiencing violence, there were also many participants who are no longer in harmful relationships, that they have broken free and gotten help. And a number of people that I interviewed are actually working now as advocates themselves, or social workers, or in healing professions. And this is just a quote from one of the participants that really stuck out to me, that there is hope and that there are ways out. And she kind of visualized it like a spider web and cutting it and getting free. So I just wanted to share that. And I think that's it. So I'll stop sharing.
Thank you.
I think I went over time a little bit, but
That is absolutely acceptable. You had a lot of information to cover, and we appreciate you so much, Janelle, for sharing your work and your research and your advocacy. We appreciate it so much. I'm going to move into just asking our panelists if they have any calls to action and then questions from the audience, but I also just wanted to reflect on a couple of things that Janelle was saying that I thought were important. Prior to being in this position here, I was working as a clinical mental health counselor, an outpatient. And I know when you're doing intakes with client after client after client, it can be easy to kind of go into autopilot. But as a nurse, it's so important to be there in the here and now with your clients, and to really be able to practice the things that Janelle was speaking to. And also I would add to not make assumptions of who are your Indigenous clients, as you can't always tell. So I would just ask for that mindfulness as you guys kind of go into this profession and treating all clients with care and mindfulness. So Janelle did give us some calls to action for what our nurse class students and watchers out there can do. Skye and Justine, is there anything that you would state that is a call to action?
Yeah, so we had a couple slides, but we don't need to share them. We can just talk through those. So we always talk about utilizing your privilege and platforms to help the cause of MMIW. I think it's really important that you act when you're called upon. I know that Indigenous communities, if there's a search party, there's so many ways that you can help in MMIW. And we really need community partnerships to push legislation and laws forward to really create change for the future of Indigenous communities. So I think that if you see any calls to actions alert around MMIW, our legislation that protects Indigenous peoples, we really rely on folks to become partners in that. I think that there's so many ways that you can use your privilege to help. I think that media is one way that we lack attention. So if you're big into social media and we have a family that's going missing, it's really important for you to help utilize your social media platforms to create awareness. And events like this are the most important, I think. Skye, do you have any thoughts?
Yeah, definitely. So I think one of the things that is an important call to action is to reach out and educate yourself on some of these root causes that we discussed today. And events like this, you know, coming down and learning from Indigenous people and providing that space to learn and to talk and think about all of these root causes that we have outlined today is really the first important step. It's one of those things that it's invaluable to begin these conversations, to participate with us and to just listen. That's really the first step, and I appreciate all of you being here to take that step with us tonight. And then the next, you can get involved by going to the Wisconsin DOJ website. We have a tab on there that says Wisconsin MMIW Task Force. And you can find all the information there for our quarterly task force meetings, which you can log into online. You can participate if you'd like, but you can also just watch and learn. We discuss a lot of these solutions that we're looking to create and a lot of the things that the community can do to support. And maybe just, you know, learn a little bit more, as well as you find all the information there for the agendas for the subcommittees. You have 4 subcommittees that are comprised of subject matter experts. As Janelle mentioned, she's the chair of the data subcommittee along with Rachel Fernandez. And it's really an opportunity for the community, system partners, family, all to bring their input. And you don't have to be Indigenous to participate in those. In any of the meetings, it's really an opportunity for all of us to come together and work towards some of these solutions.
So we're going to move into questions from the audience. Is it possible for if anyone has questions to raise your hand, and then we'll hand a mic out there? Sure. Do we have any questions?
And if not, that's perfectly okay, because I know we just bombarded you with a lot of information, and I really appreciate everybody, because it's very heavy topics that we're discussing, and there's a lot of things that are hard to hear, a lot of truths that are brand new to some of you, and things that really are, you know, it's a lot to think about. So I appreciate you guys all just being here tonight. But if there are any questions, we're available and we're able to.
Is it on?
Great question.
Is it on?
Yeah.
Oh, okay, cool. So my question is, this chunk of individuals here are from residential living. They're all staff members or part of like our residence hall leadership. And a lot of them are future educators, healthcare workers, social workers, but we're also kind of curious, like from a university standpoint, like are there other things that we can draw attention to or focus on or help advocate for potentially with like some of these topics?
That's a great question. And with leadership roles in the student body, I think a lot of what can be done is looking out for each other, keeping those avenues open for discussion and keeping an eye out for some of the risk factors, providing more support, whether it's, you know, support walking home late at night or anything like that, or, you know, making sure that that student in your hall gets to where they need to go. But I think Janelle actually would be a good person to discuss the more clinical side of it. What can be done as far as students go with that?
like on the UW-Madison campus, we do have some student-led things happening around sexual assault awareness and putting things, out in the public, just kind of getting more comfortable talking about these topics, keeping it on the radar, hanging things up in visual places about the resources that are available to students and faculty. But we have had a number of student-led, such as things like tonight, going on campus where people come together and do some learning and unlearning. And I mean, those are some things that come to mind immediately. I've also done some small group work with the SNA group, the Student Nurse Association, for the UW-Madison students, where we've talked about some of these, heavier topics in smaller groups, so people could feel free to ask questions that they might not feel comfortable asking in larger group settings. So, yeah, I think I'm not thinking of anything else right at this moment.
Just for here on campus, the Native American Center is a community of students. I would encourage you to let all of your students know that that's a resource available to them. We can provide academic support, social support, some financial support. We're here to it's really hard for a lot of Indigenous students when they come to school. They might be away from their community for the very first time, and that's kind of the intention of the Native American Center, is to have that community for that safety. And also sometimes it's difficult to discuss things with people who maybe don't have like a general background understanding of their worldview or where they're coming from or the things that they've experienced. And that's something that we can happily provide. So thank you for that question.
No, can I say something on that too? I'm just recognizing that the MMIW movement, it's an anti-violence movement, but it's a very new movement. So I think that it's really important that when you see things on social media around MMIW or you see missing families, it's important to share. It's important to educate and continue to educate ourselves around what is happening in Indian country, in Indigenous communities, because this is so new. And I think that the term MMIW, not everyone is aware of what that means. And so we really need folks to continue to create awareness around this epidemic that's happening in our communities.
And we have another question.
Two of our presenters are survivors from intimate partner violence. And when you went to seek support or help, what were the barriers that you encountered? And a second part of that is when we're talking about students, or just young people in general, culturally, they're not always aware, myself included, of what actually is wrong. First you think it's your own fault that your partner was violent, but then how do you get past that cultural thing of saying, this isn't right, what can I do about it?
Thank you for that question. I agree that there's a certain normalization of violence that occurs in any family of origin or community where that sort of thing is taking place. Would either of our panelists care to respond to the more like what barriers that they may have personally encountered and how we can encourage students and young people to be able to find the strength to be able to kind of break those cycles?
Yeah, I can talk about that. There are many barriers, and admittedly, I never sought help. I think that's one of the reasons why I'm so passionate about that topic now is, like many other the people that I interviewed, I was always afraid that law enforcement would be called. And I didn't want people, in my private business. And it really wasn't until I just didn't. I think the biggest way that I broke free is I finally discovered a group through a local shelter where I learned about a survival plan and burner phones for 911, and I became empowered. And even as someone who is a nurse and who had resources, it's incredibly isolating when you're going through a situation like that, and you're just so ashamed, you just don't want people to know. So it really wasn't until I found that group, and it's something I wish that I would have found a lot sooner. So I'm constantly promoting things like that as a nurse. So yeah, I don't know if anyone has anything else to add to that.
Yeah, and I'll add a little bit to that too. It's something that one of my dear friends and sisters, Leah Denny, talks about with her Wellness Institute all the time. And that's creating a community of care around all of us so that there's an understanding that whatever someone is going through is okay to be talked about. And when you ask about how to break through some of those barriers of maybe a victim feeling their own guilt or perceived guilt in a scenario like that, it's really creating that community of care to create an open environment so that those things can be talked about, and that anyone in any of our lives could be subjected to IPV or domestic violence or any of these things that we've discussed here today. And if we create that community of care, of taking care of each other and providing supports, even as the student body was talking about, looking for those solutions, we can create a system that is open and that these concerns can be discussed and solutions can be found together. And it really opens the door to create more of a comfort-based and solution-based environment versus the shame or guilt or the isolation, as Janelle was talking about, because it's really the case for most of the survivors that we work with. The lack of reporting is often a perception of guilt or shame, that if they come forward and ask for help, that somebody will be judging or getting in their personal business. So if we create that community of care to really show that there isn't going to be judgment, that anything is okay to be talked about, it goes back to what Justine was mentioning too about educating around the systemic issues of MMIW, and then really just getting comfortable talking about these things. If it's something that is at the forefront of our conversations, somebody experiencing it might be more comfortable saying like, hey, maybe that is something that I'm talking about, that I'm experiencing, and they'll feel more comfortable leaning on each other to help.
We have some more questions coming.
What do you think is going to be most important moving forward of both addressing MMIW and bringing awareness to it?
Education. So educating ourselves and each other about the root causes, some of the things that are preventing justice right now. Educating about the oppression tactics that have been used, and really working together to not only find those solutions, but to implement them by reaching out and caring for each other and really working hard to get those systems dismantled that are creating the oppression, that are creating the lack of justice, and the pieces that are preventing the healing part of it.
I think through our MMIW work, we found that, we superficially say there's jurisdictional issues that impact our communities, but we need to be really honest about what's happened and what historically has happened. There's intentional barriers that have been created, and the result of that is the death of our people. And so there needs to be real action, real boots on the ground, real funding changes that need to happen in order for change to happen to our communities. And I think that it's really important for us to say it with honesty and realness that there are so many barriers that are creating these issues, and we do have to educate ourselves on exactly what that is. And I'll give you some examples, we would say superficially jurisdictional issues are the problem, but when we look at our tribal police officers don't have access to some of the same tools that county officers have. One is they don't have access to the state retirement plan. So what we see is a revolving door of new recruits in our tribal communities. So if somebody does go missing or is murdered, we don't have an experienced officer that's had years of experience in looking for missing persons. We have new recruits. Those are small systematic barriers that have been put in place, and we can give more examples. When we look at the fact that every other officer in the state of Wisconsin has access to an NCIC database where they can instantly report someone that's missing, but tribal police officers have to rely on county officers to put in that information. And if you look at the old game called telephone, every time we rely on someone else to transmit information gets lost. And so then we look at funding structures. In the United States of America, there's only 60 women shelters, and every county in the state of Wisconsin has a shelter to protect women. But Indigenous communities, only 10% of our Indigenous tribes have access to that same safety for our women that are being abused. So we really need to start talking about the honest and the more specific reasons what are impacting MMIW. And those are the kind of things that we will be disclosing in our reports, but it's important for us to be really honest about how many barriers and how many layers of barriers are still existent today that we need to chop away at.
Hi, thank you all for speaking with us tonight. So I know that there's been also increased interest in the situation with missing and murdered Indigenous Two-Spirit individuals. I'm curious what the task force or what your research has found on that situation in Wisconsin. And also, are there any cases that we should be, specific cases that we can or should be raising awareness of right now?
So with our MMIW task force, we encompass all missing and murdered Indigenous people. So that is anybody of any orientation or representation. And the unfortunate fact is right now we don't have any real statistics on the number of missing and murdered Indigenous people at all, let alone information on the smaller subgroups. So that's something that we are working actively as a task force to create, and working with our system partners to identify why that is the case and who we can hold accountable to make sure that that is improved in the future.
So as we close here today, I want to thank our panelists, our collaborators, and all of you for attending. I would encourage you to stick around, enjoy some refreshments, process maybe some of this out loud with your peers, with us, as we'll still be available here. I would also encourage you to look at the art presented here by Kea. I believe truly that art can sometimes bring meaning to things that words alone cannot, and the emotions that there are there. So in closing, thank you. Thank you.